Good afternoon, everyone, and Happy New Year. My name is Courtney Goodwin. I am the social media manager here at Prisma Health. On behalf of Prisma Health, we would like to thank you for joining us for our second Facebook Live Town Hall of the New Year. As South Carolina's largest healthcare system, we conduct these Facebook Lives to provide timely and relevant information to our communities. To kick off the new year, we started a social media campaign called Being Your Healthiest You to share daily information about the importance of wellness. We all know that people make New Year resolutions, but here at Prisma Health, we want to help you focus on being your healthiest you as a lifestyle change. So today we are bringing together a panel of Prisma Health experts that will answer questions related to health, wellness, and fitness. So for today on our panel, we have John Manna. He is a nurse practitioner in the Midlands. We have Tara Ross. She's a registered dietitian in the Upstate. We have Dr. Brier San Miguel. She's an obstetrician and gynecologist in the Upstate. And we have Dr. Frank Clark, who is a psychiatrist in the Upstate, and Stephen Venugopal. He is a certified strength and conditioning specialist and manager of sports performance in the Midlands. All right, so thank you all for joining us today. So to get started, we are going to kick off with John Manna with our first question. John, so the first question is, does taking vitamin C prevent a cold?
Yeah, so that's a great question. Vitamin C itself does not prevent a cold. There are some studies out there that show that taking vitamin C regularly can decrease the duration of your symptoms by about 10%. So average cold is about 5 to 10 days. So you're looking at about a half a day to a day less worth of symptoms. But by taking it when you have a cold, it's not going to make the cold go away or prevent you from getting one. There are some interesting studies out there that show things like garlic, kiwi, and even nutritional yeast can actually prevent common colds, but you have to eat them at some pretty high amounts. So usually what I tell patients to do is just overall have a healthy diet, making sure you have plenty of antioxidants, which you're going to find in fruits and vegetables. And that's your best way to keep your immune system functioning well and to prevent colds and to allow you to recover as quickly as possible.
Thank you. We definitely need that information around this time.
Yes.
So next, we are going to move to dietitian Tara Ross. Hi, Tara. So your question is, what is clean eating and how does it help?
Yeah, so clean eating is sort of a catchphrase by this point. It originated about 15 years ago, give or take. And the concepts are somewhat loose, but they basically center around eating foods that have minimal processing or few ingredients, sometimes eating organic. Also, maybe just eating more fresh foods or raw foods can sometimes be associated with that. While I don't have a problem with any of those things I just mentioned, and I encourage a lot of that, I don't like the label. The label clean kind of makes you think that if you're not eating in that type of bucket, then you're eating dirty, So I don't really like the connotation there, but I do like the concepts behind the clean eating. And so I think taking that and maybe expanding it a little bit more to just say, okay, eating fewer processed foods or focusing on minimally processed foods. I work with a lot of patients who obviously need to eat healthier, and I don't want them to feel like they can't eat produce just because it's not fresh or organic. There's nothing wrong with frozen broccoli florets. So I really think just taking that concept and expanding it a little bit more so that you don't feel like you're so restricted to clean eating or dirty eating.
Thank you for that. So next we're going to move on to Kelly. Kelly, your question is, does menopause impact your ability to lose weight?
Sure. So this is a good question. So when you go through menopause, kind of the natural hormonal changes that are occurring in your body is that your estrogen basically is declining. So that causes the symptoms of menopause that most people, when I see patients, are bothered by, things like hot flashes, night sweats, mood swings. It also causes your metabolism to slow. And that's kind of when people get worried about losing weight, that's kind of what they're worried about, because it's more difficult to lose weight when their metabolism is slowing down. In particular, they also have a redistribution of their weight, and usually that's going to be around their middle, which has kind of long-term risks for patients, particularly being, a higher risk of cardiovascular disease. And particularly in my world, I worry so much about women, so higher for women to have cardiovascular disease. When women come to me about this and are worried when they're kind of going through the perimenopausal, menopausal change, I like to start with talking about things that kind of they can do at home. That would be things like exercise. We usually kind of recommend doing 150 minutes a week or exercising like 5 times a week if possible for at least 30 minutes. And that's kind of a mixture between aerobic exercises and resistance training. I also talk about diet. In particular, I talk to patients about like minimizing their carbohydrate. And obviously you heard from the nutritionist, she's the expert, and that can help with diet. I also just in general talk to patients too about just other lifestyle changes, such as like reducing stress and making sure they're getting enough rest. In this day and age, sometimes that's harder said than done, but always trying to focus on that.
Thank you. Those are really good tips. All right, so now let's move on to our psychiatrist, Frank Clark. So is exercise good for your mental health?
That's a very good question, Courtney. Absolutely, 100% yes. So what's good for the body is good for the mind is what I like to tell my patients. So, we know that there are a plethora of health benefits as it relates to exercise for our mental health. So I work with a population that spans anywhere from mood disorders, anxiety disorders. We know that exercise can help improve depression, can help improve anxiety. While medications can be beneficial, I think it's important for healthcare providers to prescribe exercise because we know the benefits. It can also be a brain booster, so to speak, in helping prevent a decline in cognition. We know that our population is living longer, which means that we're going to be seeing more people with dementia. And I'm not saying that if you exercise, that doesn't mean that you won't get dementia, but if we're just talking about our brain health and overall memory, exercise can help with that. Other benefits include just improving our overall confidence and self-esteem and our sleep, which is very important.
Thank you. That was great information. So now we're going to move over to John. So this is a question that some people want to know. Can you catch up when you lose sleep?
Yes. So if I'm understanding exactly what I think people are asking is if throughout the work week, say they sleep 5 hours a night, and then on the weekend, they might get 10 hours of sleep, does the total kind of equal out? And the answer to that is no. Mm-hmm. So if you are in a sleep deprivation or getting less sleep than you need, it is important to try to get a little bit more sleep. But ideally, your sleep happens regularly and happens the same every night. So the average adult needs about 7-8 hours of sleep. So usually what we recommend is trying to go to bed at the same time and wake up at the same time every day, whether it's a weekday or a weekend. I think a lot of people discount sleep and how important it is to their overall health. And there's so many studies out there that show diseases like hypertension and diabetes, obesity, heart disease are linked directly to sleep. So when we're having a sleep deprivation, not only are we tired and fatigued throughout the day, but it also leads us to have a higher chance of getting some of these chronic conditions. So sleep is essential, and that is why it's important every day that we try to get the same amount of sleep. Now, things happen, and if you have a late night one night or something like that, it is okay to every now and again take a nap or sleep in an extra hour or two to try to catch up a little bit, but you can't just catch up on the weekends for a lack of sleep throughout the week, or vice versa, catch up on the weekdays for a lack of sleep on the weekend. So I tell patients, if you're having issues with sleep, it's something that needs to get addressed. There's tons of lifestyle modifications you can do to try to get better sleep.
Thank you. I know for me, I need to follow that, getting 7-8 hours of sleep. So thank you. All right, so let's move on to Tara. Is gluten-free healthier for your diet?
Okay, so that is a loaded question. And my answer to a lot of these types of questions is it depends. If you have celiac disease, clearly it's healthier for you. Even if you might have something referred to as non-celiac gluten sensitivity, that could be another reason that you'd want to avoid it. If you just feel better avoiding gluten, or other symptoms improve, great. But as far as being healthier, that's kind of a loaded word because there's a lot of gluten-free products out there that are definitely not what I would consider a healthier alternative, a lot of junk foods and things. all gluten is it's a protein in wheat that helps to keep that wheat stretchy. Think about like pizza dough. It gives a really nice mouthfeel too, which is why a lot of gluten-free breads don't taste great. So if you don't need to avoid gluten, I don't really see the reason to. If you notice a lot of the diets that say to avoid gluten or wheat, you're avoiding a lot of processed foods, a lot of highly processed food, refined carbohydrates, which I recommend people limit anyway. So I think really if you can move towards limiting refined carbohydrates, a lot of white flours and rich flours and added sugars, that alone is probably enough to really move you into a healthier space. So again, if you need to go gluten-free for whatever reason, or if you suspect you might have either celiac disease or a gluten sensitivity, definitely talk it over with your doctor and get the appropriate types of tests done. But as far as it just being healthier, no.
Thank you. All right, so let's move on to Kelly. What are the signs of postpartum depression?
Yeah, so this is a really good question, and particularly since COVID, something that maybe has always kind of been pretty present, but I've been seeing a lot more in my patients. But postpartum depression really is kind of the feeling of sadness, anxiety, and really kind of the kind of despair that kind of prevents you from doing your day-to-day tasks. And particularly for a new mom, there's a lot of responsibilities that go into after you have a baby. Any parent will agree to you with that. Postpartum depression can actually go up to a year after having a baby. Some people aren't aware of that. And it usually kind of starts around 1 to 3 weeks after childbirth. This is actually different than what's called postpartum blues. So that happens a few days after having your baby, and that can last for like 1 or 2 weeks. That usually kind of resolves on its own. Or postpartum depression, if that's something that you're worried about, I would definitely recommend you talk to your OBGYN because it has to do with lots of hormonal changes, just the lifestyle changes of having a new baby, adjusting in your household. But you might need some type of treatment. We can offer all kinds of things. Sometimes that's multiple visits to see us. Sometimes that's seeing therapy. Sometimes that's even starting some type of medication temporarily just to help with things. But this is really important, something that I'm really passionate about because, like I said, since COVID, I feel like I've been seeing a lot more of my patients.
Thank you. I'm sure the new moms out there would appreciate that information. So let's move on to Frank. All right, does negative thinking / speaking impact your mental health?
It does. So, just to normalize it for everyone, we all have this chatter that we deal with every day. Some of it's positive chatter in our brain, some of it's negative chatter. So positive thoughts definitely change the brain, just like negative thoughts do. So yes, negative self-talk can impact our mental health. It can lead to worsening depression, worsening anxiety. So one of the approaches that we take when patients are coming in with negative thoughts or negative self-talk, we use what we call a CBT, which is cognitive behavioral therapy approach. And what cognitive behavioral therapy, basically the model looks at, our feelings influence how we think and behave, our behaviors influence our thoughts and our feelings. And so through that therapy and other forms of therapy, we encourage anyone or patients who are experiencing this negative self-talk to modify those behaviors and those thoughts. So for example, instead of saying, I can't do something, you can replace that with a positive thought of, this is hard, but I'm going to give it my best shot. Oftentimes with negative self-talk, we get into this catastrophic thinking, and then that kind of I almost kind of think about it as like a hamster in a wheel. Doesn't really go anywhere.
Thank you for that information. So now we're going to move on to John. If you're skinny, does that mean you're healthy?
Yeah, so the quick and easy answer is no. So healthy is a broad term. So it really depends on what your definition of health is. So when I'm looking at things at health, I'm really looking at a few aspects. I'm looking at, exercise, nutrition, your sleep, your stress. I'm looking at, are there risky substances such as tobacco, alcohol, or other drug use in your life? And then are you connected socially to people at work or people at home and things like that? So I'm looking at all of those realms, and being skinny doesn't necessarily fit into those. So you can be skinny and be healthy, but you can also not be skinny and be slightly healthier as well. So some of the things we look at, you can still be skinny and have like visceral fat, which is fat inside of someone's body. So the fat's not necessarily something you can see apparently, but it's still internal, and that causes a lot of issues. You can still be skinny and eat a poor diet with plenty of processed foods. You can be skinny and smoke tobacco a lot. So your risks for health can definitely decline even if you are skinny. Now, if you're skinny because you're exercising regularly, eating well, sleeping well, reducing your stress and things like that, then yes, you would be healthy. But weight is just one aspect and one piece of the puzzle, and the puzzle is over 100 pieces. So there's definitely a lot of components that go to overall health.
So we have a question that came in. I hope that you can answer this for us. How long should we wait between eating and exercising? And is that different for kids and adults?
Between eating and exercising and how long you should wait? Yeah, that's a great question. As far as the science goes, I don't think there's anything saying, hey, it needs to be exactly this long. Some people feel like when they eat, they don't exercise as well. That I usually recommend that you build a routine. So for a lot of patients, I recommend they work out first thing in the morning, usually before they even eat. So work out and then kind of eat afterwards. But some patients aren't able to tolerate that, or they might have an underlying condition such as diabetes, and they might need to eat a little bit before they work out so their blood sugar doesn't drop. So each thing's definitely patient specific. My biggest advice would be, don't eat a giant meal before you go work out, French fries and a burger or something like that, and then go work out, but trying to eat healthy, fruits, vegetables, things like that. And it really just depends on how your body can handle it.
Thank you for that. So now we're going to move on to Tara. The question is, should people avoid all fat?
So I thought we were past this by now, but it's a good question either way. No, obviously you don't want to avoid all fats. It would be really kind of impossible to do that, honestly. There are some fats that are considered essential fatty acids. So we think about omega-3s and omega-6s, which are largely in plant foods, with the exception of you've got fish for omega-3 is a good source as well. So we actually need some of those fats in our diet, and they're essential for a reason. They're good for helping with the structure of the cell membrane. They've been shown to be beneficial in heart disease, good for our brains, all kinds of things. So we definitely want to include some of those fats in our diet. And even the sources of those healthy fats may also contain some saturated fat, which we say usually you want to limit or avoid, but you can't avoid it entirely. So you could limit saturated fats, especially for those who have heart disease, which is where I work. So I do try to encourage folks to limit their saturated fat intake. The one, though, that I will say you do want to avoid is trans fat. Now, thankfully, there have been some laws passed in the last 10 years where we've slowly started removing some trans fats from our food supply. But trans fats most notably are found in margarine and shortening. So if you're going to be using that, switch to something like oil, or even butter would be a better alternative when it comes to margarine and shortening. And be aware, if you buy baked goods that you did not make yourself, you bought them from a bakery, that's likely what they're going to use, unless it's a French bakery and so they use butter. So trans fats for sure. Saturated fats, especially from high fat meats and things, probably do need to be limited, again, especially in people with that family history of heart disease or who have known heart disease. But in general, some saturated fat in the diet is fine. And then those omega-3s and omega-6s from things like nuts, seeds, avocado, olive oil, oily fish, those are going to be the big ones.
Thank you. So we had a question that came in for you. So how does food affect your mood?
Well, that's again a big question. So there's a lot of different ways you could approach that. There's definitely kind of that good feeling we get from eating something. Now that could be kind of like almost a serotonin type of release from, like carbohydrate like foods. And, for example, we feel really good eating baked goods, like I just mentioned, it's kind of that good feeling. And also the mouthfeel from the fats and stuff. There's also, nostalgia, associated with certain foods, memories. So you think about, we just came off of the holidays recently. So if, you're eating something that was a family recipe, obviously that can, create certain emotions and things. So, there's a whole area actually called nutritional psychology, which again is not my area of expertise, but it is interesting. And I think there is a lot of really good information there to really kind of go over. I don't know if Frank might have some input on that too, but I think in general, it has to do with how we process the food, what kinds of effects the food has on us, what memories we associate with the food. But generally speaking, I do feel better just anecdotally when I eat a little bit healthier. And I tend to feel good in the moment, but less healthy overall, less good overall when I'm kind of overindulging and maybe eating things that are less healthy for me.
Frank, do you have any thoughts to that question? I can pop you up here.
I would echo everything that Tara said. The only other thing I would add is maybe to the point, and I feel the same way when I eat healthy. I just feel good. When I don't eat healthy, I don't feel as well. There's this whole thing now where we're looking at the brain gut hypothesis and how, if you think about serotonin, so the majority of our medications work on serotonin. And the majority of our serotonin receptors are in our GI system. And oftentimes the brain and the gut are connected. And so what we are seeing is that, obviously we have healthy bacteria and unhealthy bacteria. And depending on what you're eating, that can, get rid of some of that healthy bacteria. And so I think there is something to be said with the connection between the brain and the gut and how our mood is affected by what we eat. Everything is in moderation, right? I tend to eat very, very healthy, but I also like a hamburger from time to time. But if I were to eat that every day, I know I wouldn't feel as well compared to my normal routine and diet.
Yeah, that makes perfect sense. All right, so now we're going to move on to Dr. Kelly. Should someone see a doctor about regularly skipping missed periods?
So that's a great question. And that's probably, as a gynecologist, something that probably 50% of all the patients that I see for my gynecological visits is for irregular periods. So just kind of in general, your menstrual cycle is usually every 21 to about 35 days. And cycles normally should last about 5 to 7 days. And so when things kind of are outside that norm is when people start coming to see me. The kind of times when I'd be the most worried is someone either goes where they don't have a period. So if they go like 3 to 6 months and they're not having a period at all, and they're not on any type of medication that's suppressing their period, I would be worried that their endometrial lining might be building up, which can kind of lead to long-term things in my world that we get worried about, such as like hyperplasia, malignancy. Or, another thing I'd be worried about is when people go through menopause and then they start bleeding, even if it's just a little bit of bleeding. Again, I would be worried about something kind of more concerning. And so, that would definitely be something that I'd recommend a patient come to see the gynecologist. Other kind of signs and other reasons I'd recommend people make an appointment with a gynecologist is if they were kind of bleeding or spotting between their periods, especially if their periods were very normal, then they had kind of a change. If they were bleeding or spotting after intercourse, if they had heavier periods. So if their periods were to change, they used to kind of be normal, had normal pad count, tampon count, and then all of a sudden they're having a lot heavier clots, they're feeling tired, fatigued, I'd recommend they come see a gynecologist. Also, if just in general, their periods are outside these kind of norms, if they're lasting longer than a week, and that wasn't what it was before, anything kind of irregular, I'd recommend they see us. When I start doing a workup, I always kind of make sure a patient's up to date on their pap smear first, but then I think about what could be causing these irregular periods. And it can be lots of things. It can do anything from something that's structural, things like fibroids, which are common in the reproductive age population, basically benign growths that can happen in the uterus. And there's a lot of different treatment options for that. It could also be things like other structural reasons like polyps or endometriosis, adenomyosis, and there can be hormonal changes that can cause irregular periods. That can be things that, affect ovulation, such as, sometimes what I get a lot of patients, because they love to Google, is they'll kind of Google like PCOS, so polycystic ovarian syndrome, which one of the symptoms is irregular periods. And so that's a longer conversation because it has a lot of medical complications that happens with patients, as well as even patients trying to get pregnant. Other things that can kind of cause irregular periods are just, certain medications, if they also have bleeding disorders, and then kind of other causes.
Thank you. So we have a question that came in for you. So how long does premenopause last for most women?
So that's very variable, and it's kind of tailored to every patient. I say, so the general age of menopause is about 50 if you look at a bell curve, but there are people that go through menopause before that age and after that age. Usually the perimenopausal, it can be anywhere from 1 to 2 years, but it could last up to 7 years. The true definition of menopause is when you go a full calendar year without a menstrual cycle. So usually when people are going through the perimenopausal phase, they basically start having less common periods. So they might go a few months without having a period. If you're ever concerned, I always still recommend, make an appointment, see the gynecologist. We can talk about that. Usually at the same time with the perimenopausal kind of phase, people start getting the symptoms of hot flashes, night sweats. And that's also very variable how much it affects you and what we can do for treatment.
Thank you for answering that question. So now we're going to move on to Frank. So what is seasonal affective disorder and how can people combat this during the winter months?
That's a very good question. So seasonal affective disorder, I characterize it as clinical depression with a seasonal pattern. So I think a lot of times people are most familiar with the winter pattern. So if you live far north or south of the equator, the days get shorter, less light hours during the day. So I'm from Chicago. We don't get a lot of sunlight in the wintertime, but if you're living in like Alaska or New England, you're definitely not seeing a lot of sun during the winter times. Not as much as like with South Carolina, we have, our temperatures are not as cold, frigid, and I would say we see pretty good sunlight throughout the year. So it has to be going on for 2 consecutive years. So you would have to meet criteria for clinical depression and have specific symptoms related to that seasonal pattern. So winter pattern, people are usually, we call it the hibernation period, so to speak. So you're more likely to carbohydrate crave. You may be sleeping more. We call that hypersomnia. Again, you may have more of an increased appetite and crave carbohydrates. There's another pattern that people may not be familiar with, and that's the summer pattern of seasonal affective disorder. And so sometimes when people are experiencing the summer pattern of SAD, so to speak, seasonal affective disorder, they may feel a little restless. Appetite may actually be decreased, and they can experience some insomnia. There are different reasons why people may develop seasonal affective disorder. So if we think about sunlight is responsible for controlling the levels of molecules that help maintain serotonin. As we talked about earlier, it was alluded to, serotonin helps with our mood. There's also melatonin that helps regulate our sleep-wake cycles. So you don't want too much melatonin production, but you don't want too little. So there has to be that balance, or homeostasis is what we kind of look at. And then, all of us can probably benefit from more vitamin D. We don't really see the daylight as much, especially if we're inside our offices. So, deficits in vitamin D can also contribute to less serotonergic activity. We try to get our vitamin D through foods, but that doesn't always happen depending on what we're eating. And then, the sunlight. How can people combat seasonal affective disorder? So there's more than one tool in the toolbox, so to speak, for treatment. SSRIs, also known as selective serotonin reuptake inhibitors, basically work on serotonin. Those are like Prozac, Zoloft, Paxil. Those are conventional treatments that have been shown to be helpful for seasonal affective disorder. There can also be light therapy. So I encourage my patients, if they do have a seasonal pattern related to depression, to get a light box. You can do it for 30 to 45 minutes in the morning, which can be very helpful. And then there's also psychotherapy to help with that seasonal pattern of depression.
Thank you so much for the information. That was really good. Now we're going to move over to John. Is it normal to be less active as you age?
So as far as amount of activity, not necessarily as far as like performance goes, right? So in your 20s, you might be able to run faster than you would in your 60s, and that's normal. But as far as being active, I don't suggest that. as you get older, you become more sedentary. So that's really what I'm looking at. And what I mean by sedentary is you're sitting down all day, you're not really standing, you're not really walking. For most adults, we recommend at least the minimum is 150 minutes of exercise a week. And that doesn't have to necessarily be strenuous, but it needs to be some type of intentional exercise. So I usually tell people get up and go walking. 30 minutes a day is a perfect amount. It can be in the evening with family after dinner. It can be in the morning. It can be at a lunch break or something like that. So even as we start to age, you should still be trying to walk. As you become more sedentary, it becomes harder to regain some of that back. So your muscles start to atrophy or start to become smaller and not as strong. And overall, physical inactivity is the fourth leading risk factor for death in the world, which I think is something that we overlook so often. So physical inactivity leads to so many other issues, and it's one of the biggest causes of causing chronic conditions and things to get worse, and then essentially for patients to have poor outcomes because of that. So I always tell patients, if you're struggling to be active, there are resources that are out there. Always talk to your provider. A lot of times for elderly patients, we can even get home health to come out there and get physical therapy or occupational therapy to come to their homes and teach them some exercises to do and how to be active. I tell people who are older but working jobs still, don't sit at the desk all day. If you can get a standing desk, or every so often just take a lap or go outside and walk around. Those things are very important, because once we stop the physical activity, we become inactive, and it's really hard to get back on it. Not just, mentally, but really physically, it gets harder. And then your chronic conditions, if you have them or don't have them, can progress pretty rapidly.
Thank you. I think that was a very popular question that people wanted to know. We had a question that come in for you. How often should men get a prostate cancer test?
Well, like a lot of these questions, there's not, one straight answer. So it depends on family history. So for all cancer screenings, if you have a family history, so first degree relative, so say your father had prostate cancer, screening starts about 10 years prior to when they were diagnosed. And then if you don't have a family history, usually it depends on some risk factors. So there's other risk factors you want to look at, but generally speaking, African-American males usually age 45, and then everyone else usually age 50. Now, PSA levels is what we call them. It's blood work. It's not going to say yes or no to cancer. It's going to look at overall like inflammation of the prostate. So they can be elevated with many other causes, and it's something you need to trend, because if you start doing them, you really should do them at least once a year, because you want to look at the trends. And if it's going up quickly, then it is more concerning, even if it's in normal limits. So it's something you do want to keep an eye on if that's the modality of testing you're going for. And the other thing I remind most of the men as well is prostate cancer is very common. Most elderly men, 80, 90 years old, they don't even do screening. And the reason why is most of those men have prostate cancer, but they don't die from prostate cancer. They die from some other cause, and then they find out that they had prostate cancer as well. Prostate cancer is extremely slow growing. So it isn't something that has to be, taken care of within a day or two or the next day. It's slow growing, and we're able to kind of monitor those PSA levels. But for most men, 45 to 50, but usually what I tell men is you should be seeing a primary care provider sooner than that, because colonoscopy start at 45. So cancer screening is going to start, minimum age 45. And if you don't need it and it's not specialized towards you, then we can push that out. But if you don't have a primary care provider, it's, essential to get one so we can keep up with preventative screening. Because one of the most important things we can do is prevent disease, right? So if you come in and see us, we can help prevent anything from happening rather than coming to us when something has already happened. So the number one thing is build a relationship with a primary care provider, and they'll be able to help you decide what the best age is for you.
Thank you. I'm sure the men who are tuning in would appreciate that information. So now we're going to move over to Tara. So we had a question that came in for you. Do you recommend a daily vitamin for healthy adults over 50?
Yeah, so I call a multivitamin sort of like paying your insurance premium. So you don't know that you need to use all of that, benefit, but you're hoping that it's there if you do. So I tell people to look for one that is a brand name that they trust. Most over the counter, if you look, they'll have a USP symbol on the label. That's good to look for. Even take it a step further, you could look for something labeled as NSF, which means it's certified safe for sport. Athletes have to go through rigorous testing. So that really helps to make sure the product is, safer to take. Now, supplements are not as well regulated as foods. And so as far as, looking at the claims and saying, okay, does this have what I need to have in it? Most of the name brands that you find over the counter will be decent. Now, you can pay more for more specialty products. Some are worth it, some are not. So I always recommend, talking with a dietitian or somebody who's knowledgeable about that kind of thing. But for most people, I would say, yeah, a multivitamin, basic over-the-counter multivitamin is probably not going to hurt. Do you need it? Maybe not. But as long as it fits in the budget, it's not too expensive, I think it's fine.
Thank you. So another question for you is it healthier to be a vegetarian?
Okay, so it depends. Yes, a vegetarian diet can be very healthy. It can also be very unhealthy, so you could eat nothing but Doritos and Oreos and technically still be a vegetarian. So it really just depends on where you're coming from. Vegetarian diet, includes, or could include, I should say, some animal foods like eggs and dairy. If you're vegan, though, then that eliminates those sources as well, which makes it much more difficult for some people to adhere to. I think both of those diets, when done well, can be very good. It just depends on, again, if you're planning your meals appropriately, if you're making sure you're meeting all your nutritional needs. Protein, I find, is usually not a big deal for vegetarians. It can sometimes be a little bit more of a stretch for vegans without the use of some of these, sort of products, vegetarian meats and, plant-based meat products and things. The other thing I would say to watch out for is kind of like what I just mentioned. Those products tend to be highly processed. So you might have higher sodium levels or just other things, added to it that you don't necessarily want. But my philosophy with a lot of my patients, clearly being with heart disease, they do want to eat more plant forward, or what I call plant powered, meaning that they're adding more plant foods into their diet, but I don't think they need to go 100%. So I usually try to encourage them to aim further down the line towards that, plant-based diet, but not necessarily to go all in, especially if they're not ready for that or not able to do that. Sometimes it can be very stressful trying to plan all of these meals and get all the right nutrients, especially on a limited budget. And then there's just the willingness, right? What if you don't want to give up chicken and fish and beef and all that? I totally understand and I respect that. So I think it just depends on the person and making sure that they're adhering to the diet properly. A few key nutrients to look out for. So B12, which again, on a vegetarian diet, not as hard to meet, but on a vegan diet, you would just want to make sure you're getting some fortified foods or using something like nutritional yeast. Iron can sometimes be an issue. Calcium occasionally too. And then depending on how low fat that particular diet goes, again, just watching out for some of those good sources of fats, like we mentioned earlier. So things like flax seeds, olive oil or avocado or nuts, things like that.
Thank you. So now we're going to move on to Dr. Kelly. Should someone with a family history of breast cancer get mammograms earlier than the recommended age?
Sure. So that's a really good question. So in general, my professional society is ACOG. So if you have an average risk, then we recommend that mammograms start at age 40. However, people that have a higher risk, and that's seen when you look at the American Cancer Society, these individuals would include people that actually have a known BRCA mutation, so BRCA1 and 2. It would also include people that have either a family history, so that would be people that have a first-degree relative, a second-degree relative, or even a third-degree relative with BRCA disease. Or if a patient had like breast cancer, a risk assessment, and if their risk was between 20 and 25% or even greater, their lifetime risk of developing breast cancer, then I would kind of recommend getting screening early. Other kind of risk factors would if a patient had chest radiation, or if they had any type of genetic diseases. Just in general, having a first degree relative. So when I say first degree, I mean that's either like a sister, a mother, a daughter. It does kind of double their risk of getting breast cancer. And then if they had 2 first degree, it just kind of continues to add to that risk. This can always be a conversation with patients, to kind of talk about their family history, talk about, breast cancer is actually very common in the population now. And again, we're always trying to do preventative medicine, try to prevent something from happening or finding out if someone does develop breast cancer earlier stages than later stages. But again, that can be a conversation with your OBGYN. If you do end up finding out you are a BRCA gene positive, so either BRCA1 or 2, then yes, they do recommend getting a screening early. That usually starts about age 30. But even before that, you would get screening, but that would be more in the realm of doing like clinical breast exams and doing MRIs. But then at 30, then you would kind of be alternating between mammograms and doing MRIs.
Thank you. So now we're going to move on to Frank. Is there treatment for social anxiety?
That's a great question. There is. Social anxiety is one of the either third or fourth most common mental health conditions. Generalized anxiety is one of those conditions that we see mainly in the primary care settings. I see a lot of my patients with generalized anxiety, but also social anxiety. But as it relates to social anxiety, I think the thing that I always try to impress upon with my patients is that oftentimes patients with social anxiety disorder, there is this fear of judgment or ridicule or embarrassment or perceived embarrassment, or that people are going to be judging them. And so oftentimes when they're in social situations, they may avoid those situations for fear of being judged. And so one of the things that I think is important to be mindful of is that most people with anxiety disorders also have co-occurring mood disorders like depression. So oftentimes, if the anxiety is not well controlled, the depression gets worse. If the depression is not well controlled, the anxiety gets worse. The other thing with social anxiety is that I often screen, well, I always screen, but especially with social anxiety disorders, we know that alcohol use can be prevalent. Doesn't mean that people are abusing alcohol or dependent on it, but oftentimes they're using alcohol as a way to alleviate that fear of being in social situations. And so what I impress upon my patients is that, screening for alcohol and alcohol use disorder, do they feel like alcohol is a problem for them? Are there healthier ways to manage social anxiety? Medications are one piece of the puzzle. Again, some of the conventional SSRIs that I mentioned earlier, Zoloft, Paxil, Prozac, Lexapro can all be very beneficial for individuals with social anxiety. Therapy works. I'm a big proponent of therapy. Medications are not the end all be all. I'll say that again. In fact, in terms of research, when you combine therapy with medications, overall, you're going to see better outcomes.
Thank you. So we had a question that came in for you. So once you start taking medication for depression, do you need to take it forever?
That's a popular question. So what we know is that the more depressive episodes someone has, the likelihood that they're going to require medication lifelong is going to increase. So if you have one depressive episode, according to the guidelines, so my organization is the APA, the American Psychiatric Association. So the guidelines would say that we would want a person with their first episode of depression to at least be on medications at least 6 months to a year. I usually favor a year. Now, within that time, if they're doing better and their symptoms are in remission, their quality of life and overall functioning is better, and they feel like they're living their best life. If they come in and they say, I would really like to talk about maybe starting to taper off of this medication, that's a conversation that I'm always willing to have. But the caveat is that I share with people that, your symptoms could return. That's the risk. But if you want to taper off, we would do that. And my thing is always involving people in shared decision-making, and that they understand the risks versus benefits of any decision that they make. If they have had 2 or more depressive episodes, the conversation is going to be a little different. I'm still going to, there's still going to be shared decision making, and I'm going to, talk about the risk of having future depressive episodes. But in the end, it's going to be up to the patient. So, and then we also look at family history. We look at other things. I tend not to try to make medication changes when somebody is in crisis, and somebody says, "Oh, I think I want to come off of my antidepressant," but they're telling me that they have all this, all these different psychosocial stressors. I may recommend and say, can we pause that for a second and maybe let's get through the holidays, or let's look at, maybe there's another time that we can have this conversation. But doesn't mean that you have to stay on medications forever. But it depends is the best way I'll put it.
Right. Thank you. Well, thank you all for joining us today and sharing this important information about health and wellness. I believe that's all the questions that we have. So at this time, what I would like to do is just go around and have our panelists provide any final thoughts for our audience. So first, let's go ahead and get started with John. Can you provide any final thoughts for us, please?
Yeah, so as I think we kind of probably could all agree and have talked about, there's plenty of questions, and there's definitely most questions don't have a simple answer. A lot of times it depends on the patient, and that's why it's so important to have a primary care provider who knows you and who knows every part about you to figure out what the best plan of care is. So when you have these questions, you can ask them, and the primary care provider a lot of times kind of acts as the gatekeeper, right? So they can manage a lot of first line things, but they can also get you into specialists, and we have relationships with a ton of other specialists, and we know who can really help you. So if you need other help, we can get you into where you need and really make sure that's seen. So my number one recommendation for everyone is to have a primary care provider, even if at this time you don't have health concerns, because building that relationship, A, when either acute concerns come up, or B, later down the road, we can help prevent things from happening. So building that relationship, that doesn't mean you have to get seen every year, but it does mean building that relationship. We like to see you usually every year to every 2 years and just make sure things are going well.
Thank you. Tara, do you have any final thoughts or comments?
Yeah, I think, because of just the nature of my job, I get people always asking, what's the one food I can eat, or what's the best diet, these kind of questions. And, honestly, what I usually do with people like that is I say, what are you doing now? And what's just one way that you could tweak that and make it just a little bit better? These small changes, small steps over time are really what's going to give you better results. This time of year, everybody's doing these resolutions and joining gyms and maybe starting new diets and programs. And that's fine. That's great if it gets you motivated about things. But keep in mind that changing yourself too much, or, taking too big of a step sometimes leaves you right back where you were. So I say small steps are key. Pick one specific action. It could be, incorporating leafy greens into your diet. It could be something as simple as drinking an extra 8 ounces of water, whatever it is. Pick one specific step to start taking, and you'll actually see better results from that long-term than you will from trying to do anything too drastic.
Thank you. Kelly, any final thoughts?
Yes, so kind of in addition to having a primary care provider, I also recommend patients, have an OB/GYN. It's important just in general for GYN care, making sure that you maintain you're up to date on your pap smears, that someone's kind of talking to you about your wishes for fertility, talking to you if you aren't ready to have children, that you are in control and that you are on birth control, if that's something you desire, as well as just in general talking about your menstrual cycles and making sure that you're kind of staying healthy. Everything's kind of related. And then on the flip side, the other part of my job is talking to new parents or soon to be new parents and obstetrics. And, there's a lot to go on, especially again with the new year. If you do get the exciting news of getting pregnant, we want you to have prenatal care. We want to make sure you have the best outcome for your pregnancy and for your baby, and that you get the kind of whole pregnancy that you want, you desire, as well as have the delivery process that you want. And that, we are very, in the Upstate and kind of in general in Prisma, we are baby friendly. And so we want you to have that bonding time. We want you to be a part of, developing this new family in the Upstate and helping us grow our population.
Thank you. All right. Frank, any final comments?
Yeah, so there's still a lot of stigma when it comes to seeing a psychiatrist or a psychiatric provider. So I guess the things I would want to leave our audience members with, it's important to take care of yourself. You don't necessarily have to come see a psychiatrist like myself. I'm a firm believer that everybody can benefit from seeing a therapist. I see my therapist twice a month. I'll just put that out there because I think that in order for me to take care of my patients, I have to be able to take care of myself. So I think a lot of our population continues to suffer in silence. We've gone through a lot of things in our society with COVID and there's a lot of loss. So if you are not feeling well, please don't don't hesitate to reach out to someone. We are here for you. We are here to serve you. We care about you. And I just wanted to put that out there because I think there are a lot of people that are still suffering and they don't know where to turn, or they think that they are less than, especially men. I'm going to put this out here for men because we don't always talk about our feelings. We are all hurting, men, women, children, grandparents. We are all hurting at different points in our life. And if you need someone to reach out to, please don't hesitate.
Thank you. That was very good. All right. Well, thank you to our audience for tuning in today. If you have any additional questions, please leave them in the comments and we'll answer them as soon as possible. If you would like to schedule an appointment with our providers or learn more, please visit our website. And we hope to see you at our next Facebook Live Town Hall. Thank you.